care is about aligning care systems in the development and the humanitarian context. Essentially, we'll be discussing why aligning care system is so important, and we'll have a peer from Child Frontiers, sort of give us uh, a presentation on why this is important, and we'll have two country examples from Uganda and Kenya. In Uganda, we'll have Sophie, discuss some of the ongoing efforts behind the care systems and what challenges they have encountered so far. And from Kenya, we'll have Patrick also share experiences from UNICEF, especially from Kakuman refugees, around what they've done so far in terms of making sure that uh, uh, making sure that there are no parallel systems, or that systems and interventions within the humanitarian context are aligned to the broader child care and protection systems. And this sort of builds in the discussion we had previously around the necessity of aligning care systems to the broader child protection systems, and of course the advantages that come uh, with that. Um, uh, and before we invite Pierre to give us the introductory presentation on why it's necessary to align systems, I'll invite Mona just to give us an overview and also welcome the participants.
Thank you, Ismail. I guess Mona is not on the line, probably because of the connection. So maybe Mona, just checking if you are still online. Otherwise, I would just start on her behalf. Ismail, maybe I should proceed, I guess.
Sure, kindly proceed. Thank you.
Thank you so much. So good morning, everyone. My name is Belleta Birara. I'm a child protection specialist in UNICEF ISARO. A very warm welcome to all representatives, including government representatives, sorry, who are with us today, changing the way we care colleagues, UNICEF child protection colleagues, and the various CISO partners working in the area of care reform in the region and beyond. So maybe before we start, I would like to go through some of the webinar protocols that will enable us to have a smooth and lively session. I already see that you've already started introducing yourself in the chat box, so please do so by typing your name, job title, and the country office that you are representing today. I would like to also request Berta to administer the polls and to, sorry, colleagues, and to hear participants to kindly complete a short poll so that we know who is in the room. I would like to also kindly request all participants to mute your microphone during the session. You are all encouraged to type in the chat box any questions and comments that you may have, and we will ensure that to respond to them. You may also use the raise hand button if you want to ask questions directly. I already see the recording has started, and we'll share the recording of this webinar after the session for your reference. For colleagues who are not also on the mailing list and who would like to learn about future platform events, please complete. Colleagues, I think there is kindly mute yourself. Okay, so yeah, As I said, if you'd like to join the mailing list to learn about any future platform, events on care reform in the region, I'm going to type a link to a Google form in the chat box, and please feel free to complete this Google form. You can also reach out to our colleague, Emily Delap, who is also on the line. We'll also make sure to type her email address. Having said this, let me now start this webinar by introducing a little bit of the learning platform. So the regional learning platform on care has been established by UNICEF in collaboration with the Changing the Way We Care to exchange learning on care across the region, across Eastern and Southern African region. The management of the platform is supported by the consultancy firm Child Frontiers, and we have Emily Delap as the lead consultant of this work. The regional learning platform on care reform provides an opportunity for government, UNICEF, and civil society organizations in the region in Eastern and Southern Africa to share learning on care reform, and activities began in October 2020. And we have included 5 virtual study tours, a series of webinars, and a help desk. We've completed phase 1 of the platform, and this webinar is the 3rd activity for phase 2, which will run until January next year. And the operationalization of this platform is made possible with funding from USAID's Displaced Children and Orphans Fund through UNICEF ISARO. Phase 2 will focus on priority learning areas as identified by stakeholders in the region, including supporting families to care for children, kafala, adoption, and lessons learned from the COVID pandemic. And learning needs will be made through webinars, reflective practice, and a small group exchange, practitioner videos, case studies from children in care and caregivers, help desk, as well as monthly updates. So the purpose of the webinar today is to present on the Aligning Care Systems in Humanitarian Development Contexts paper. The webinar today will explore the importance of ensuring that care systems developed in humanitarian settings adhere to national standards and contribute to the development of national care systems. As Ismail was highlighting, examples from Uganda and Kenya will illustrate how care systems in refugee camps can be aligned with the national care system. So colleagues, just wanted to also mention that questions will be taken at the end, but feel free to ask any questions you have as they occur, and let's use the chat box. And now I would like to give the floor to maybe back to Ismail or Pia, who will provide an overview of the aligning care systems in humanitarian development context. And yeah, just to also say a few things in terms of Pia's presentation. Pia will introduce herself later. So Pia will present on the forms of emergencies and humanitarian crises, why alignments and creating linkages is important and how this can be done. What are the implications or consequences of not doing so? She'll also highlight some of the examples of promising practices from different contexts. And following Pia's presentation, we will have a case study, complexities of care for unaccompanied separate children and ongoing efforts to align care systems in Uganda, which will be presented by Sophie of UNHCR Uganda. And after that, we'll also have a case study on efforts to align care systems in humanitarian development context in Kenya, which will be presented by Patrick from UNICEF Kenya. And Ismail has already started facilitation, so he will continue to facilitate the Q&A session, and Emily may also backstop. So without further ado, let me now pass the floor to Pia, or maybe back to Ismail. Over to you. Thank you.
Thank you so much for that introduction. I think we'll just pass the microphone to Pia. Thank you.
Hello, everybody. Good morning, good afternoon, whatever it is with you. My name is Pia Vralson. I am a senior associate with Child Frontiers, but I think what I will be presenting today is a little bit broader than that. Looking at the bigger picture, the overview of where do we sit in terms of child protection systems and aligning those systems in humanitarian and development contexts. Now, I know today we're speaking specifically about care systems, but the way that I have outlined this presentation is to speak a little bit more broadly about child protection systems in this type of context, which include care systems, and especially for the East and Southern Southern African regions. A lot of this is actually focused very specifically on care, given that's where a lot of the focus is at the moment. Next slide, please, Emily. Right, so I thought I would start with talking a little bit more specifically about what are some of the global lessons that we have. And these global lessons are based on several studies, pieces of research and evaluations, which also include the ESA region, but also more widely. And what we have found pretty much unilaterally across all of these studies and evaluations is that in emergencies or humanitarian contexts, there tends to be a tendency to follow a blueprint approach and an overly pre-prescribed approach. So what has been done in one context, whether that be within the same region or neighboring countries or an entirely different region in the world, there is a tendency to pre-import what has been done in other places to other contexts without adequate contextualization. And contextualization really comes out as a key theme, as a lacking area. And this runs the risk of establishing parallel systems. So without taking into consideration what exists already in the country at the national level or at the local level, systems are just sort of superimposed or imported. And as I said, this leads to a lack of contextually appropriate programs. So before the needs are fully understood or the most appropriate means of addressing those needs, there are already programs designed. And I'll speak a little bit later in my presentation about some of the reasons that seems to be a pattern or a trend, and what some of the problem areas or potential opportunities are. Next slide, please, Emily. Right, and what we see as, I guess we could say, a challenge, but more so an opportunity, is how are we connecting all of these dots? And what we see is that systems are often not perceived as holistic. So the tendency for actors is to work on certain components or parts of a system, but not looking at it as a bigger picture. And that includes the local level. So what's happening in communities, the sort of non-formal child protection systems that many of us are working with, and how that connects to the national system and wider policies and frameworks that exist, or wider endeavors, for example, at a ministry level. What we also find, and I'll get to this later in my presentation, is how are we connecting the dots in terms of how care systems, or child protection more specifically, sit within a wider framework. And those of us who work on care know that there's many different actors that are involved in tapping into the different areas that are required to meet care holistically. It doesn't just sit within child protection. It sits within many different sectors, whether that be education, health, nutrition, livelihood, etc. And that also includes in humanitarian contexts. And again, that also comes to how are we connecting the dots between what already exists in a country in terms of development program and how that interacts with a humanitarian situation or context. And if those sort of dots all around these different peripheries and spheres are actually meeting each other and providing that bigger picture of the context in which a child and family sit, not these sort of different silos that quite often we tend to create in the work that we do. And that includes both prevention and response, as I'm sure all of you are working on. Next slide, please, Emily. Right, so what do we know about the region at the moment? Sorry, there's a small typo there on my first paragraph. So we know that in the East and Southern Africa region, there has been, as there has been in sort of globally, a shift from looking at thematic approaches and looking at the overall system. And I think that's one of the reasons as well why I'm trying to touch on this, not just from the perspective of care, but how care sits within a wider scenario picture for children and families and child protection more broadly. Now, what we find in the region, oh, sorry, Emily, can you go back from, oh no, forward, sorry. There we go. Oh, yeah, that's it. Is that, for example, if we're speaking about humanitarian context, and I was really, really pleased to hear that the examples of Uganda and Kenya were going to be unpacked in more detail, because they're very, very illustrative of some of the more progressive work that's taking place in this region. But also there is a sort of wider regional approach to how things are taking place. So as I said, there's the shift from looking at thematic issues. So for example, street children or sexual exploitation or children associated with fighting forces and armed groups, etc., to looking at this in a wider context. As we know, many of these children don't fall squarely, or children and families don't fall squarely into one little box. They fall into many. And in terms of prevention and response, that needs to be looked at in terms of a more comprehensive picture. Depending on the context, what we are seeing in this region is that there's an increasing move in terms of policy and legislation. And this is not just country specific. We're seeing a lot of regional initiatives coming up in terms of interagency regional working groups. We're also seeing, for example, platforms such as EGAD and the EAC getting increasingly involved in these different sort of regional policies, coordination and frameworks. And what we see a lot in this region, and Uganda and Kenya will be able to speak to this in more detail, is the particular challenge of refugee children in this region. And we know that the East and Southern Africa region has a high number of refugee populations, but also displaced populations. And the challenge there has been in terms of a parallel system that exists for dealing specifically to those children's needs. So they're not incorporated in national systems or legislation or policies, and the challenges that that has perpetuated in terms of meeting their needs and access to services. And that, given the high number of unaccompanied and separated children in this region, that poses very specific challenges. Next slide, please, Emily. Right, so setting the scene, East and Southern Africa. I've seen the majority of you, except for a few, are based in this region, and many of you in contexts that experience frequent emergencies. So what is the lay of the land? So in East and Southern Africa, this won't come as any surprise, we have protracted emergencies, also known as complex emergencies, that have been going on for decades and that are ongoing. So for example, the South Sudan, Somalia, the Ethiopia, we have other countries that are affected by ongoing crises, such as Northern Uganda, Kenya, Tanzania, with high numbers of refugees. We also have in this region a lot of sudden onset emergencies. For example, the natural disasters that we see are characterizing a lot of the Southern African countries, Madagascar, Mozambique, Zimbabwe, South Africa, Namibia, whether they be cyclones, drought, flooding, etc. I think the important part here to take forward in that is that very few of these emergencies are sort of singular. They have multiple drivers and a lot of structural factors. And I think the more this is picked apart in the region, the more we're able to understand that bigger picture. So very few of these countries are affected by one singular type of emergency. For example, the ones with protracted crises are also facing natural disasters, which tend to exacerbate the pre-existing emergency. Or we have a lot of these countries like Madagascar and Mozambique that are affected by cyclical emergencies. And by that, I mean, it's not a one-off event, even if it's sudden onset. These are nearly predictable on an annual basis. And what is interesting, although there are a lot of information gaps in these areas, we do have quite a lot of real-time evaluations, et cetera, that have been conducted in these countries, which give us some kind of indicator to assess how humanitarian action and alignment with development contexts has played out or continues to play out. Next slide, please, Emily. Right, so in a nutshell, what I've tried to do is to look at what are some of the overarching challenges, what are some of the opportunities. And what you will see from these slides is that a lot of the challenges or opportunities are conversely so. So some of the challenges that are presented are equally so opportunities, and some of the opportunities that we see are equally so at this moment in time challenges. So the tendency overall in terms of challenges is to approach humanitarian needs as a separate area or a separate approach from the national or development agenda. And I guess one of the big questions there is this really a different set of priorities and actors? What we see or have seen, and this is decades long, is that the humanitarian response is often dealt with by a separate set of authorities. So when an emergency happens, and this is in particular to those who have sudden onset type of context, is that an entirely different government authority or different stakeholders in the international community take responsibility. So in a lot of countries, this would take, for example, the form of a national disaster commission. In Uganda, as I'm sure Sophie will touch on, it would be the office of the Prime Minister. And this means that it almost becomes debilitating for those who are often part of your sort of streamline development program. They almost aren't part of that immediate response and responsibility, and it sort of sits separate. We also see, and this point comes up really, really strongly in the context of sudden onset. And real-time evaluations show us this again and again, year after year, is that there is an influx of humanitarian actors. And by that, I mean this division of the people who deal with the humanitarian scenario and the people who deal with the development scenario. And it's often been described nearly word for word in lots of studies and evaluations, as in they come and they leave. So they come into an emergency. There's very little alignment or discussion with what's already happening in country, whether that be at the national level or the local level, and that it ends up becoming a vacuum of parallel systems that are established to deal with the emergency. And then as soon as they've started, they leave. And it leaves a vacuum where there is little to no transition from what was part of an emergency response to what is absorbed into a longer term development response. This is particularly problematic from the point of view of care systems, because it's often been described as you have this case management approach, you have lots of children who are absorbed into a case management approach, But as soon as that sort of immediate emergency response has taken place, they're sort of left, you know, off a bit of a cliff, it's been described at times, with nothing to absorb them into this longer term system. And as we know, with care, it does require a longer term approach. So that's particularly problematic. So again, structural gaps. Who has the remit? Who has the mandate? Who is responsible? And it often ends up in this kind of flurry. In protracted emergencies, and I see many of you, for example, working in South Sudan, and you might be able to speak to this differently, or Uganda or Kenya, who have a long-standing refugee population. This is perhaps more absorbed into the system, but still remains a gap. And fortunately, particularly in Kenya, which I know a little bit better, we've seen a lot of progress in terms of how national structures, organizations, institutions, policies have made a lot of progress in terms of making sure that that's brought into the bigger picture. Next slide, please, Emily. Right. So another challenge, lack of capacity. And by this, I mean, we're already looking at under-resourced environments. When an emergency happens, and in particular in protracted emergencies where we see a lot of issues around competition for funding and dwindling funding, this is an issue. And we also look at this from the point of view that a lot of people who work in development contexts, as I said in the beginning, who is responsible? And a lot of the time it is seen as so separate and an area of expertise that is different, that it is often almost like a standoff type of attitude. Like well, it doesn't pertain to me. That's not part of what I do. It's not part of my program. We don't have the expertise, and we don't have the manpower, and we don't have the finances. So that, and you'll see as I move on in my slides, that conversely can actually become an opportunity in emergencies. Lack of access to affected areas and populations. Quite often we find that access is restricted when it comes to emergencies. Mozambique being a very recent example, with what's been happening in northern Mozambique and lack of access to those who are affected. That pertains not only to the international community, but quite often first and foremost to the local authorities and the national authorities. So quite often this ends up being sort of, again, separate or something that we are unable to access and deal with in immediate terms. Populations who fall outside of national and local level policy and legislation, I think I've touched on this already, but given the high number of refugees in this region, this remains a significant challenge. And again, I look forward to hearing from Uganda and Kenya, who've made real progress in that area. Streamlighting data monitoring and evaluation. It sounds not so important, but actually it's hugely important. We all know, those of us who work for organizations that are needing to muster funds, capacity, advocate for interagency or multi-sector working. Without data, this becomes really difficult. And we find that data mechanisms, whether they're data collection, data storing, data analysis, how those outcomes for children and families continue to be monitored and evaluated, are usually kept completely separate. And that remains a real challenge for trying to also bring these two systems together and look at how they're working together coherently and how they can potentially complement each other. Next slide, please, Emily. Right, so what are some of the opportunities? And like I said, a lot of the challenges actually also present opportunities. And I guess the big slogan here that we've all heard many times, especially over the last decade, is how can we use emergencies or humanitarian settings as an opportunity to build back better? And I would just, outside of this region, just like to say that Ukraine, which is on, everybody's minds and donors' minds and resources at the moment, is also really trying to look at how do we use what is currently happening in Ukraine, not just as a means to respond to the immediate crises and needs that are emerging, but looking at the longer term picture of how to use this as an opportunity to continue to bolster capacity, to continue to utilize resources, to utilize in-country capacity, for example, manpower, to really look at the more long-term picture. Also post-immediate crises over the longer term. So here we look at a lot of work that's been done in the region recently is looking at, given how under-resourced family and children's welfare generally is, how are we using wider initiatives to also piggyback on? So that includes multi-sector. And this comes from 2 points of view. One being, we know that in order to address children and families' needs, we need to be taking a more holistic approach, which includes our health colleagues, it includes our education colleagues, it includes livelihood, etc. And how are we also looking at other sectors that are more resourced and to utilize some of their platforms to not only improve outcomes for children and families, but also tap into wider coordination, wider outreach that is taking place, wider advocacy efforts. And humanitarian contexts pose perhaps even more so of a springboard to enable us to do that. So here again, improving coordination. We know that in most humanitarian contexts, all of a sudden, all these other coordination groups emerge, and they can sit in parallel to what already exists, or we can find ways to ultimately capitalize on that increase in coordination. And that includes advocacy, that includes multi-sector working, data collection, and all kinds of things. And again, humanitarian contexts often can be a springboard for that. As I said, opportunity to improve advocacy, joint funding appeals, and emergencies can often give a voice, right? They can raise a profile. We saw that in Mozambique. We see that periodically in South Africa, for example. And they can sort of raise the profile again and be able to set the bar, not just for what's happening in the humanitarian context, but also more widely in the development context. It can also, as much as it can limit access to wider populations in geographical areas, in some ways, sometimes it also becomes the enabler for accessing populations that we don't normally access or work with. Or, for example, looking at communities that have become displaced, which again, with the ongoing drought at the moment, which we're seeing all over the region, all of a sudden kind of forces us into looking at different pockets and different ways of working with those pockets, which can be an opportunity. Next slide, please, Emily. Right, another one is cross-border. And many people would say, oh gosh, but cross-border is a challenge. And in many ways, cross-border is a challenge, but it's also a massive opportunity. And I think out of all the regions in the world that I've worked in recent years, I have to say East and Southern Africa seems to be the most progressive in this area. So we're seeing a lot of cross-border initiatives taking place in this region, both at the higher level political arena, but also when it comes to, for example, technical working groups on PSS or case management specifically, and developing some shared standards and tools which are utilized in terms of cross-border mechanisms, whether that be through immigration or more broadly interagency, And that has posed a real opportunity, not one without challenges, let's be fair, but an opportunity that continues to sort of mold and take shape and move forward. And linked to this is what we're also seeing at the higher level, as I said, in terms of political leveraging. So for example, through the EAC, through EGAD, specifically on child protection and system strengthening, for example, the roadmap that is being developed on strengthening national child protection systems and cross-border collaboration, but also, as I said, wider initiatives that child protection and care systems specifically are able to leverage opportunities, like the regional migration policies, more recently COVID plans that are also cross-border and regional, that provide platforms also for child protection system strengthening and care specifically. And also I'd like to say lastly on this, increasing momentum for working with national and local level child protection systems. And again, I think there's a lot of real interesting initiatives taking place in this region that are looking at that sort of duality. So how are we working with the national system, but how is that also looking to complement or work specifically with local level systems? Case management in this region is a prime example of that, where we see, for example, the diagnostic tools, which are also cross-border, that are being developed, etc. Next slide, please, Emily. Right. I'm not going to go into detail about the specifics of individual things that are happening in countries. I just wanted to provide this last slide as a sort of a snapshot to kind of, I guess, get us all thinking about the interesting things that are happening in this region, which don't have to sort of sit in this sort of cloud area, but are much more tangible. And so Patrick, I think, will speak about this in more detail, but for some examples would be the guidelines for alternative family care and children in Kenya, which have specific provisions for refugee children. And I interestingly was able to travel to some of the northern areas of Kenya relatively recently, and it was extremely interesting to see how much local authorities have woven those humanitarian and refugee children and families' needs into their local level action plans, etc. Really very interesting. Child officers handling individual cases of refugees. We see that both in Kenya and Uganda. I'm sure I'm missing some countries out here, by the way. Feel free to add, but these are just sort of a little bit of a taster. In Tanzania, we find government social workers working with individual refugee children. This has been programs and initiatives taking place over a long period of time that have really seen an evolution. New social work curriculum to include community-based child protection structures, mirroring community mechanisms. And I saw we had a colleague here from Rwanda. And it would be interesting to have more exchange on that. But as I said, these are just sort of a little bit of a taster. A lot of the initiatives that we find taking place, which unfortunately are not very well documented to date, are actually really happening in these pockets at the very local level. Yeah. Anyway, I think that's all from me, and I look forward to hearing from all of you and from our colleagues in Uganda and Kenya. Thank you.
Thank you so much, Pierre. In the interest of time, I'll just invite Sophie from UNHCR. For those that have any questions or reactions to Pierre's presentation, feel free to use the chat box, but also feel free to share your experiences, your insights, but also any examples of promising practices from your country in the chat box, and we'll get back to that later. Sophie, you're most welcome.
Yes, I hope you can hear me and that you can see my screen, colleagues. Yeah, can you confirm to me, Ismail?
Yes, I can see your screen.
Okay, great. So, yeah, good morning, good afternoon, here from Poland quickly, on my way back to Uganda almost. Talking in this seminar or webinar about our experience in Uganda. So my name is Sophie Etzold. I work as a child protection officer with UNHCR in Uganda for the past 2-3 years. And yeah, I would like to share basically back some of the maybe challenges, opportunities, achievements that we jointly, I would say, achieved with the partners working on alternative care, but also really with the ministry and the alternative care unit in this presentation. So I will give a little bit of an overview maybe of the refugee situation, a few stats and numbers on unaccompanied and separated children in Uganda, and then outlining what kind of gaps and challenges we faced on alternative care specifically in the refugee context, and then what process we took to align ourselves to the efforts that were developed over the last years, let me say, on developing the national alternative care framework and how this kind of played out and where we are at and what's the way forward. So just maybe to outline very broad stroke numbers, we have currently a bit more than 1.5 million refugees and asylum seekers in Uganda, registered with the Office of the Prime Minister, who is responsible for the protection, registration, etc. of refugees in Uganda. And a significant number of those, so 860,000 are more actually than that figure, but roughly are children, refugee children. So that is a figure that is beyond what other countries actually host in the total refugee population. So it is a challenge by itself to, you know, make equal access and apply really all, you know, a systems approach to this large number of refugee children. Here quickly a figure of adolescents as well of roughly 270,000. And then we know of a number of roughly 55,000 children that have specific child protection risks. So this can be, of course, including being exposed to different forms of violence, could be child labor, child marriage, and unaccompanied and separated children. So here on the left chart, you can see kind of data from the first quarter of this year of individual children that have something that we call specific needs codes in the UNHCR kind of terminology, but it's like that are separated or unaccompanied children, and as such identified in a database and data management system, Progress V4, that is used by the government for registration purposes, but also for the refugee response, was approved to be used for case management services. Yeah. So just to flag out this high number of separated and unaccompanied children requiring really specific attention when it comes to case management and linked to that alternative care needs. And Pia has mentioned that, you know, that linkage, integrating basically children into a case management system that is linked to alternative care is by itself really intense, requires intense resources when it comes to staffing, additional funds, and programs linked to that. So that's an overview. And then we have kind of mapped, and that is one thing I think that stands out also in the whole of the region, the community-based approaches that we see in East Africa. And so in Uganda, we have mapped in the different settlements the current number of foster families, so community-based foster families who have, either expressed their willingness or taken care actually of a number of children, unaccompanied children under their care. So here you see, of course, the largest settlements, so Bidibidi, Adjumani, Palabek, for example, Parodinia, they do have large populations of up to over 200,000 refugees at a time. So for example, when you look into Bidibidi and the Adjumani settlements, and within those, we have a significant number actually of foster families taking care of this large number of unaccompanied separated children, or unaccompanied children actually, in those settlements. As was really reflected, I think, very much in detail and well by Pia, that indeed in refugee situations, in emergency situations, you do have often, you know, parallel systems or, you know, additional systems or a gap in system for refugee children actually requiring alternative care. And what we did in 2019-20 is kind of to see what is actually the care situation for refugee children on the ground. And we've done kind of an assessment on the gaps and the challenges. And so just to outline some of the gaps that we identified and that we then wanted to work on. So first of all, we've seen in the refugee context, with this large number of children requiring alternative care, that there was an absolute inadequate staffing. Inadequate staffing to assess the needs of children, to place children in alternative care, to build alternative care systems, to monitor alternative care systems. And that I'm saying at the kind of national side, but also through the supplementary support basically of international agency, there was just inadequate staffing to actually stem that resource or to provide comprehensive support to this group of children at specific risk. Basically, there was a limited level of participation in children in decision making that also comes from that initial also inadequate staffing. So inadequate staffing with regards also to the capacity of staffing to involve and engage children really from the onset of the process, get their views and make sure that all children, regardless of age or gender or diversity considerations, would be able to meaningfully actually participate in the decision making on where are they placed, what relates to reunification procedures with potentially other relatives and family members, parents, etc. There was also a general kind of limitations, I would say, of comprehensive assessments used that are linked to case management procedures when it comes to assessment of alternative care systems. So foster families, agencies that were providing care and support have kind of used agency specific or limited forms or no forms actually when placing children in spontaneous or more systemized alternative care forms and foster care. And that obviously has to do with accountability to risks that can stem from that, etc. So that was one of the most grave, I think, challenges that we have identified. And here again, also the linkages, when families were assessed, how does this actually translate to a best interest process or a case management process where then children are able to participate meaningfully in, but really linking those two processes of assessing actually suitable care families and looking at the individual needs of an individual child, matching those two together. And how is this linked, documented and systemized in the refugee context, that was seen as a gap area. So all of this, of course, noting that there was very limited follow-up and monitoring of individual children, given the high demands that this brings, the limitations in staffing. And we've also seen that the efforts that were undertaken at the national level through the development of the alternative care framework over the last years, actually, still we could see that there was a lack of harmonization actually in the capacity building effort. So it was very agency based and it was very much based on the technical advisors that were identified within agencies, some of which had more or less child protection capacity, but there was no kind of harmonized curriculum or capacity development process that harmonizes basically the alternative care framework, be it in the national level, including refugee children, or at the kind of parallel system in the refugee context. And also one aspect that relates very much also to UNHCR's mandate in ensuring that refugee children, where there is no local integration opportunity, that there is a process of identification of durable solutions, particularly for unaccompanied children, so that durable solutions and solutions for children are found in a longer process. So that's usually beyond 2 years or in the process of 2 years. So those challenges were identified and were taken very much into consideration. They were also presented, of course, to the ministry. And then we thought, okay, how do we go about it? And some of the consequences, of course, that stem from that is really kind of a risk landscape in that sense. So we've seen inadequate or inappropriate care arrangement, placement into potentially institutionalized care, or complete lack of care arrangement, actually leaving children as child-headed households, for example, or under insufficient care. It had led to dropout of care arrangements by children, and overall an instability actually in the child's life and in the care arrangement. There was also really the limited support that was rendered to foster families, and the limited harmonization in this process when it comes to, capacity support, psychosocial support, involving them in case management, planning, financial support, and standardization kind of overall the program that supports families or foster families, that really also resulted in a neglect or a dropout of care arrangements and of foster families in this process. We have had instances where we recorded abuse and exploitation in care arrangements, that were then brought, of course, to our attention and were changed. But that is, of course, one kind of consequence and a result from inadequate mechanisms and capacities around alternative care. And yeah, the lack of long-term kind of care, integration, and durable solutions opportunities, also with family members that might exist, but also under the foster care program, has been seen as a clear risk and shortfalling in the refugee response. So what did we do then? So talking about the risks identified really, or that stem from the limitations in the programs, we have been liaising with the alternative care unit in the ministry and our colleagues there, Mr. Butanda and Ismail, over the course of really several years. And we're grateful that really there was a willingness, I would say a strong willingness actually, from the national system to integrate refugee-related situations and emergency situations in the national alternative care framework. So there were consultations that were, starting in 2018 and 19 to integrate really the refugee-related specific aspects in the framework itself, and there are chapters that really outline the specific needs of refugee children. And we were able basically also to outline in the refugee context adoption specific aspects. As you might know, that adoption is something that we try not to foster in an emergency context, given the obvious need for really tracing and comprehensive kind of durable solution aspects. Then, so we were part basically and were involved, integrated in this revision of the National Alternative Care Framework, which was, I think, one first step. And then based on that, I think we have tried to develop a framework that links the case management process that was ongoing with the development of forms that guide also caseworkers, noting the lack of capacity that I've mentioned of, agency staff in terms of numbers, but also knowledge on how do I actually make such an assessment? How do I make sure that I involve different levels of the community, plus caseworkers, plus children, adolescents in this process? And we've developed kind of, in addition to the existing process of the national framework that outlines really very clearly how things should be done, have a kind of additional guidance forms developed for caseworkers to identify suitable foster families and to screen and assess foster families, and then to align those, approve those through the national systems, and come basically to a comprehensive process that involves community level, that involves NGO, civil society, and really involves the probation and social welfare officers in a final approval stage, and really working together jointly on such assessment in the end. And then have agreed from that process. So this form, the forms and the process that we have just outlined were presented and reviewed by the ministry and the alternative care unit in several sessions that we held with our colleagues from UNICEF, UNHCR, and the ministry. we received feedback, incorporated this into the forms, and then kind of finalized this process, and are now in a phase of rollout. So all agencies that are involved in alternative care in the refugee situation in Uganda are required to use these forms to assess, identify foster care, and then properly place children based on necessity and suitability and the best interest process in place. And at the same time, we've developed maybe more collaboration with the colleagues from the ministry on rolling out the existing training platforms and capacity development platforms from the National Alternative Care Framework in the refugee settlement, so that really we support through financial support, etc., capacity support, collaboration, and so on. The rollout of trainings that were initially planned also at the national level, but support this rollout within all refugee settlements. And yeah, I think we came to a wonderful actually result where really we tried initially this kind of more separated parallel system in the refugee situation, or the inefficient system as well, to align those furthermore to the national development of this plan, work together and support as well, given the stretched constraints as well of the social welfare platform and the ministry, try to really support this process throughout and work together to include refugee children into the national system. Yeah. Here again, just an overview on how this forms. Basically, we have developed these 5 forms at different community, civil society level, etc., and involvement of here the probation and social welfare officers and OPM, so the Office of the Prime Minister. So the 2 kind of bodies technically and in terms of responsibility for the refugee situation, to get them involved and approve the system. So to have a formalized actually approach to foster care, which is a first in our context. And the last slide, so what impact has this brought to us? Obviously, this creates much more of a safeguarding process on alternative care and an increase in quality. Yeah, so we have professional staff that are trained on these forms and on alternative care through the linkage on the capacity building efforts that are ongoing on the national level, plus the training on the forms that we wish to use. The forms themselves, they have a lot of guiding questions. They are based on also the information that is in the alternative care national framework forms, but have kind of more additional guiding questions so that we can make sure they really assess properly the families. This all is linked to the best interest tools in place and to a recommendation that is integrated in the best interest assessments then, yeah? So those tools at the alternative care framework level need to come up with a recommendation that is integrated in the best interest protocol, basically. And overall, I mean, the level of professional probation and social welfare officers that are integrated and should have the final kind of approval and access also to this data on alternative care in refugee situations has, of course, increased the safeguarding of this process. Overall, we hope that this, of course, reaches to a harmonization of alternative care in Uganda and is really aligned to also the principles enshrined in the UNCRC. So with regards to really harmonizing processes, procedures, and services support for all children in the territory of Uganda. And so this has hopefully also, you know, increased kind of the strengthening of the leadership role of the national system furthermore. And I think that's a process that we will continue to engage in with the ministry and the alternative care unit, but that slowly we turn away from a refugee kind of led response where UNHCR and partners take the lead on that, but rather really giving responsibility and accountability leadership to those that are actually primarily responsible, that have worked tremendously in developing the national framework, actually integrating and working towards an integrative approach of refugee children in Uganda. So I close with that here, and I'm happy to answer any further questions or have further comments also from the colleagues of the alternative care unit. Thank you.
Thank you so much, Sophie, and it's great to see you. Hope you travel back safely. I know that we are overrunning, so I'll ask participants to type any questions that you might have for Sophie in the chat box, and we'll get back to those questions. But also feel free to share any particular examples of alignment work that's going on in your country, as well as your experiences. Again, thank you, Sophie. Patrick, uh, over to you. Patrick, are you there? Yeah, and someone in the chat is saying that's very inspiring, Sophie. Um, Patrick?
Ishmael, I can see that he's there, but he's perhaps struggling to be heard. Maybe while we're waiting, we could ask participants to complete the poll and take a couple of questions, and then hopefully Patrick can sort his sound out.
Sure. So, yeah, yes, as we wait for Patrick to, as we sort out the audio issues, I think we can do the quick poll, and then Patrick, can you hear me? Thank you, Sophie. That would be helpful, sharing the presentation. Um, so as we try to get Patrick, kindly help us complete the poll. It's up on the screen. Um, also, if you have any particular questions for Pierre and questions for Sophie, kindly type them here, and we'll be able to request them to answer those. Patrick, can you hear me? Patrick? I can see Patrick is trying to sort out his audio, so I guess we hope that he will be able to.
Maybe you can go to the microphone settings. Maybe that's where the challenge is.
Okay, thank you. That's helpful, certainly. Patrick, can you check with your microphone setting? Okay. In the meantime, as we get Patrick, are there any particular questions for Sophie and Pierre? Feel free to unmute yourself and then ask any question that you might have.
Patrick, are you able to speak now? Oh. Patrick, can you say something to see if we can hear you? Okay. Oh, I think we might have a question from Grace Ishmael.
Yes, Grace. I can see your hand up. Kindly go ahead.
Yeah, thank you so much. Good morning, good afternoon, and thank you for those that have shared their presentations that are very, very informative. My comment is this cohort of children, children in the humanitarian settings is very, very important cohort, and there is quite a number of children facing the challenges of displacement across the continent. Are there plans to scale up these positive efforts across Africa so that they are not in just some places, but the good practice we can observe today can be shared across Africa? And I think one way it is to ensure that the AU is aware of what's happening, and they are also, it's brought to them these good practices, considering most of these children are coming from, within Africa. And a good example, I work and practice in Kenya. You find, many children coming from our neighboring countries across the continent. So my question is, are there plans to scale up the good efforts and the practice across and within the African continent? Thank you.
Thank you, Grace. Pierre, can you quickly respond to that?
Yeah, I can actually. And I think that's a really good question, Grace. I think there are efforts underway to sort of consolidate this information in terms of learning, but also there is a roadmap that has been developed that includes the EAC and EGAD specifically, and an interagency group, the Regional Child Protection Network. And what they're trying to do is to consolidate some of those lessons learned and bring some of that to scale, for example, and this is draft, okay? But in terms of bringing some of that to scale in terms of specific countries to implement the roadmap. I will say that I think because of COVID, a lot of these plans were put on the back burner because they simply weren't possible and there were other priorities. But I think at the moment that some of these things will start sort of rolling again. I know there is already discussion and dialogue about that. And like I said, I think those include a lot of the important regional bodies, but also other regions. And I think that's really important in terms of movement migration that is broader outside of this sort of context. So I hope that answers your question in part, but yes. And I would just like to refer back to Sophie's presentation. And I think that I hope there are increased efforts to sort of like harness some of these real progressive attempts that are taking place. Yeah, so I hope that answers some of your question.
It does, thank you. And the next question I would ask, since 2020, there has been a study on children without parental care. And my little understanding in terms of the children without parental care, children in refugee settings can end up becoming children without parental care. Have we, I am wondering whether this team or this platform has sought to interact with the report, with that study on children without parental care in Africa, to be able to ensure that children in refugee settings or in humanitarian settings have been captured well, and the recommendations that are provided are in line with the good practices that are being promoted today. Thank you.
Hello, Ishmael, can you hear me now?
Yes, Patrick. Glad to hear you, and I'm glad that the technology has been very kind to us. So you're most welcome, and we are all looking forward to hearing from you.
You will be projecting for me. I shared my presentation.
Yes.
Ishmael?
Let me pull up. Yes.
Yeah, okay.
Let me try to pull up your presentation.
Okay.
Ishmael,
Yes.
I can do that if you like. I've just seen
Okay.
it.
Sure. Thanks.
Yeah. Good afternoon, colleagues. Apologies for that hitch. I think the docking station had a problem, and when I disconnected now, I'm able to be heard. I could hear you all, but you could not hear me. As I tried to start the presentation, my name is Karanja Patrick. I'm based in the Kakuman refugee camp. And I also have my colleagues, Patrick Wekesa from the Danish Refugee Council, Mirka Sang from UNHCR, and also Diana from the Danish Refugee Council. We were supposed to have our sub-county children's officer with us, but there is an ongoing scholarship program that he is chairing, and he was not able to join us. My colleagues will also be joining me when we have going to the question time, so that they can be able to respond to some of the questions that might be coming from the panel. Can we go to the next slide? Yes, just to give you an overview of the Kakuman refugee camp, we have a population currently as of 31st of March 2022, about 227,987, and of those 49% are females, and 52% of the registered refugee asylum seekers are children, that is 0 to 17 years. So basically what it means is like Kakuman and Karabay refugee camp, we call it a children's refugee camp, and most of them are mainly from South Sudan, where most of the refugees are men, 51%. Those ones that are aged 30 and older are mostly women. And over half of the refugee and Turkana households, and this is because we also have the integrated development and humanitarian nexus, where we have the Karabay integrated program. We also talk of the surrounding hosting communities, and most of the households are headed by women, 56% and 52% respectively. We also have refugee households that are led by women, tend to be larger, and they have more dependents than those that are led by men. Next slide. Yes, just to give an indication of the number of the unaccompanied and separated children at the Kakuman Karabay refugee camp. Those are the numbers. We have a total of the separated children at 60, that is 6,902, and the ones who are unaccompanied, 1,721. That is as of the data that we got from UNHCR last year, June, from Progress before. Maybe the number has changed slightly, but those are the numbers that we are talking about. That is in total about 69 plus 17. That is about 80 something, but on average, because there are also children who spontaneously unify with other family, extended family members, we always talk of about 14,000 unaccompanied and separated children. But that is the data that we have from Progress before. The next slide, please. Yes, for refugee children who are in alternative family care, Emily, seems as if you reduced the presentation. Could you increase?
Yeah, too small.
Yes, it's too small, but it was bigger initially. Yes, that is okay. Yeah, that is okay now. The number of refugee children in alternative family care, and this is from the Child Protection Information Management System that we use here in the Kakuma refugee camp. As of 10th of May yesterday, the numbers that we generated from the system, those children who are in the child-headed households are 744. The ones who are in foster care, former foster care, 641. The ones who are in former foster care are 250. And just to clarify the difference between the formal and non-formal foster placement, it's the formal placement are the ones who have been placed through a care placement, that is a placement form, but these are the others who are in non-formal are the ones who have not yet been formalized, but they have been praised as the team is working on formalization through the paperwork. But they are already, the preparations have already been done with the foster parents, and the placements have already been made. The ones who are in safe shelter are 11. then supervised group care 13. So in total, we have 1,659 children who are in alternative family care as per the Child Protection Information Management System. Thank you. Go to the next slide. Now, I spoke about the integrated development and humanitarian nexus. As of 2018, the county, that is the subnational level county government, because we are under the devolved government system as after the promulgation of the 2010 Kenya Constitution. In 2018, the county government of Turkana, together with UNHCR and other partners, started working on looking at how can we integrate refugee children into, or the refugee and children, including the other people of concern, into the national system, and started a pilot of a pilot that is called Karabay Integrated Socio-Economic Development Plan. Under this umbrella, the UNHCR and UNICEF started collaborating to look at how do we bring government on board and make sure that there is a better government leadership in terms of making sure that we could be able to also include enhance the inclusion of refugee children into the national child protection system. In March 2019, UNICEF used the comparative advantage of the advocating with the government, and we, for the first time, we brought the national level director of the Directorate of the Children's Services to visit Kakuman for the first time. And during that mission, the mission team observed a lot of good practices that were happening in terms of the case management for refugee children, including placement of children in alternative care, as well as the integration component of where the schools now had both refugees and the hosting community children also being part of that is of the inclusion in terms of the participation in all the schools, that is both in the refugee camp and also in the surrounding hosting community. And during that mission, it was agreed that it was important that the Directorate of Children's Services deploys a children's officer who would be focusing on refugee children issues to come and support UNHCR, UNICEF, and other partners for case management as well, and also placement of children in foster care arrangements. And in addition, it was also discussed that under the umbrella of the integrated development and humanitarian nexus, we were also looking at how can we work on development of a standard curriculum to make sure that all social service workforce practitioners would undergo a standard training curriculum that was anchored at the Kenya School of Government. So we started that discussion at that level, and immediately started working on developing training curriculum that is jointly with the Directorate of Children's Services and also the Kenya School of Government. And we developed a curriculum for both professionals and also for the para-professionals, that is the child protection volunteers and other practitioners, so that we could be able to at least make sure that communities are also becoming protection part of the community support structures, supported by a para-professional cadre that is robust and also well trained and can be able to support in that. In March 2020, there was also a multi-sectoral forum that was arranged jointly by UNHCR and UNICEF at the Nairobi level, where all partners met and discussed on what are the best practices in terms of case management and also supporting the most vulnerable refugee and host community children. And during that forum, it was agreed that the director that was responsible for alternative family care should also come on mission in Kakuma, and also so that they could also be cognizant of what are the good practices and that are happening, and how we be able to jointly collaborate and try to align the case management guidelines and also the alternative family care guidelines of 2014, which had also refugee children included, and make sure that we could be able to apply them, and also based on the best practices that were happening in Kakuman and Karabay. And a capacity building workshop was convened, and 30 partners, including UNHCR, UNICEF, the government, and other stakeholders, were trained on the alternative family care guidelines of 2014. And during that training, we identified a lot of good practices, but also some elements of the areas or gaps where we were not following the foster placement rules, and that were as per the Kenya 2014 alternative family care guidelines. And it was also agreed that there were very good practices that were happening in Kakuma, and we would avoid at all that is non-disruption of the good practices that were already happening, and make sure that the gradual formalization of alternative family care, both in Kakuma and also in the Dadaab refugee operation areas, it was agreed that this should be done gradually so that we do not disrupt the good practices that are happening. The next slide. Yeah, and based on I have picked a few areas of the unique practices and disparities that were identified during the training on the alternative family care guidelines in Kakuma. And some of them, to start with, is, for example, the fostering of children by people of the opposite sex, which is clearly stipulated in the guideline that anybody of the opposite sex should not foster a child. And we were looking at that. We identified some of these unique practices that are happening in Kakuma, and made some of the observations so that we could then escalate these to the higher levels in the ministry, and be able to develop some standard operating procedures for that would be annexed to the alternative family care guidelines for the refugee operation areas based on the uniqueness. And what we were saying is that we should be able to provide exceptions in the refugee context, or provide for fostering of children by persons of the opposite sex. And the justification is also based on the evidence and the data generated from the information management system, where most of the foster parents are women. And if we were to apply the guidelines to the letter, then it would mean that very many children would not be eligible to be fostered, because most of the foster parents are women. Then there were also no reports of sexual abuse reported against foster parents who are fostering children of the opposite sex, and cognizance of the emerging threats of the LGBTQ being a reality, then even if we were to stick to the guidelines, then there would also be opportunities, if that would be the argument, then some children would also be sodomized, irrespective of being fostered by somebody of the same sex. Then the next disparity was the period of foster care. According to the guidelines, the foster care placement period is for a maximum of 3 years. That is according to the Kenya 2014 guidelines. However, in the Kakuman refugee camp, we have situations where the children have been in foster placement for longer than 3 years, as it is stipulated in the guidelines. So our thinking was, would we be exempted through the standard development of the standard operating procedures and making sure that we could be exempted from that as we extend the number of the years from 3 maybe to 5 years, as we look at the options of having transiting into guardianship. And also the justification, of course, was the bonding between the child and the foster family, issues of hard to meet requirements for foster parents in the camp setup, and also some foster care arrangements begin from the country of origin, and limiting them to 3 years would not be applicable in our setup. Can we go to the next slide? Then there is the issue of the institutional care. Kenya is now piloting that is the issue of non-institutionalization of children. That is through several pilots in the country. And of course, the issue of institutional care progressively will be done away with. And therefore, what we were suggesting is that we should have provision for refugee operation areas where there should be provision for therapeutic child protection centers, that is especially for at least refugee children, and on a temporary basis, pending seeking for alternative durable solutions, and also based on the severity of their cases. That is, for example, we have seen very many cases of abduction threats. We have issues of blood revenge, especially for those communities from South Sudan, and also the threat of child marriage. There's also the issues of following a committal order or a decision of the case, the bid panels where the circumstances would demand, and therefore we were requesting that based on that, then we would have a standard operation procedure that would exempt very exemptional circumstances for the refugee setup, where we would still be having some therapeutic child protection centers in the refugee operation areas. Then the other one is regarding the placement of a child within an alternative family unit of the same ethnicity and or culture. That is in the 2014 guidelines, the provision is that you are supposed to place a child within an alternative family care unit of the same ethnicity or culture. But for our setup in the refugee camp, the provision our thinking was that we should, the provision should take account the uniqueness of the refugee context and allow for placement of children on a case-by-case basis. And the justification was some children are fostered by families of different ethnicities in the refugee context. And this is evidenced by the data that is generated from our case child protection information management system. We also have prospects of fostering across communities, which is sometimes it is easier to foster children among some communities than others. And this is very unique for the refugee setup, where, for example, you might have a Burundian prospective foster parent who is willing to foster a child from another ethnic group or culture, and therefore making it very unique for our setup. Go to the next slide, please. Then there's the issue of children in mixed marriages. For our context, we have mixed marriages. For example, Kenyans married to refugees, and the legal position is that we require consent from either parent for a child to accompany one parent out of Kenya, especially for situations of durable solutions. And for durable solutions, it is only applicable to refugees and not for Kenyans. So some of we have a lot of complexities when it comes to children from mixed marriages, and we have unions that are cash or legally binding, that involves Kenyans and refugees, and therefore our argument was that for the camp context, cases of one parent being registered under one name, we have situations where some parents are registered under one name. They are also untraceable parents. For example, a refugee child was fathered by a Kenyan, but you cannot trace the Kenyan parent. They separated, and this affects cases of children who are under consideration for durable solutions, that is for resettlement. And therefore, the way forward that we were proposing is to have the law to clearly define parameters under which such children can be accorded support, and of course on a case-by-case basis. Then the issue of standardization of tools. As I previously mentioned during my introduction, the issues of alternative family care placements have been happening for a very long time in Kakuman, but of course not adhering to the national guidelines. But when the government came on board, there is a lot of understanding and agreement that formalization process should be done gradually, so that we do not disrupt the good practices that are happening. And therefore, the issue of the standardization of the existing tools to comply with government guidelines would require us to work jointly with government, that is UNHCR, UNICEF, and all the other partners, implementing partners, so that we can start with the verification of the case load, and as we align the AFC, or the alternative family care placements in the refugee camp, then we also look at how do we also align the tools so that they can run concurrent. The issue of formalization of the alternative family care arrangement also would need us to also look at the interoperability of the system that we are using for the refugee children case management, including foster care, and looking at also the child protection information system that the government is using. As you noted during the introduction, we already got a deployment of a sub-county that is a government official working in the refugee setup. And of course, according to the guidelines, any placement of the fostered or a child in foster care is supposed to be done by or signed off by government. That is the placement order. It's supposed to be done by the Department of Children's Services. And therefore, the question was, how do we now make sure that government is also getting or trying to track and monitor all children who are placed in foster care? And therefore, the issue of trying also to look at how can we make sure that when cases are referred to the children's officer, then they are also able to document that into the government system, but also not jeopardizing the security and also the confidentiality of the individual refugee child that is placed under foster care or is being supported under the case management processes. So there are a number of areas that we have already tried to look at so that we are able to work with the government and make sure that we are able to align the foster placement in the refugee operational areas with the alternative family care guidelines of 2014. Next slide. So finally, what we did is that we at least assigned a small team that was a combination of the legal colleagues from UNHCR, child protection experts from UNICEF, from DRC implementing partners and others. And this small team now looked at what are those critical areas that are very unique that would put our case across so that the higher levels of government at the national level could listen to us and approve the development of a standard operating procedure to guide the progressive transition and alignment of our alternative care guide system in the refugee operation areas. So this has already been done, and we are waiting for the approval by the permanent secretary in the Ministry of Labor so that we can proceed and start the development of the standard operating procedures for both Kakuman and Dadaab. I thank you all, and jointly with my colleagues, we will be able to answer any questions that might be coming from the panel. Thank you.
Thank you, Patrick. That's very rich information there that you've just shared. I can see we've overrun this by a couple of minutes. If you have any quick questions for Patrick, feel free to raise your hand. And I hope that we can round this up in the next 5 minutes. Any questions for Patrick? Yes, Bernard, I agree. Very clear and detailed presentation. And great work, Patrick, there and colleagues. I think it's exciting to see all these efforts, but also, you know, the realization, especially at the national level and the government level, and their willingness to accommodate such requests. So I think, yes, Grace, your hand is up.
Yeah, thank you so much, Ismael, and thank you, Patrick. How are you and how is Kakuma?
Kakuma is very good and very cool. It's the rainy season. Thank you.
Great. Yeah, I see you. There's a recommendation or envisioned of having centers, child care centers within the refugee camps. Is it a state land or a private land? That is one. Two, there is Dadaab and Kakuma as well. It's the same program, this very exciting program of promoting family and community-based care for children in refugee settings. Is it being practiced in the other refugee centers in Kenya? Thank you.
Could you repeat your second question, Grace?
Yeah, my second question, if you can hear me, it's about the practice, if it has been scaled up to other refugee settings within Kenya. And I'm also aware there are many refugees in the urban centers, whether that same practice is happening. Thank you.
Yeah, thank you, Grace. And to answer your first question, and I would also request that my colleagues, Diana, Mirka, and Patrick can also jump in to clarify. The issue of having some rescue center or therapeutic centers, these are in terms of those very, very dire cases that will require emergency placement. And because now Kenya is moving into deinstitutionalization, then what we are requesting government is that we should still be having at least one rescue center, and this one is not necessarily being in the camp, inside the camp. The county government is already in the process of finalizing the construction of a rescue center that will be accommodating both refugee and host community children, but not necessarily going back to institutionalization, but at least praying that we get provision for having an emergency center where we could place children as we look for alternative solutions that are family-based care. That is in terms of family-based care. Then for these other practices, that is what is the best practices that are happening at the Kakuma, Karabay, in fact, including in the urban centers, and I think my colleagues from UNHCR can also clarify that. It is also happening in the urban centers, and also including in Dadaab, where the predominantly it is the kafara system that is operating for mainly where we have larger populations of the Somali communities. I would request my colleagues from UNHCR or DRC to add on to what I have said, if any. Thank you.
Thank you, Patrick. Any other questions for Patrick? If not, this is to kindly remind you that our next webinar will be on June 22nd, and we'll be focusing on harnessing the power of data to improve the care and protection of children without parental care. In the chat box, there is if you'd like to join the mailing list or to learn more about the future platform events, there is a short Google form that you can complete in the chat box. But also a reminder that this webinar is recorded. So in the chat box, we've also put a YouTube channel where you can, and a link to the YouTube channel that you can click and then you know, listen back to some of the conversations that have happened. We are very grateful. We know that we've overrun this by about 25 minutes. So we are very glad that you, for those that have been able to stay. So I'll hand back the microphone to Mr. Bilete.
Thanks, Ismail. Actually, just to say many thanks to everyone for the active participation in the lively session, and special thanks to our facilitators and presenters. Ismail, yourself, Pia, Sophie, Patrick, Emily, Berta, and also my colleague Mona, who couldn't join us due to connection issues. But we have been really working hard on and leading on this initiative with colleagues online. So thanks everyone. Apologies for taking some more time and also for the technical issues, but special thanks to Patrick for sorting those technical issues and sharing those interesting experiences from Kenya. We have the announcement already for the next webinar, which will be on the 22nd of June. So look forward to connecting with you all again. So thank you everyone, and goodbye for now.
Thank you.